Good evening, ladies and gentlemen, my distinguished panelists and all the viewers. I am Dr. Nishant Sharma, and welcome back to another series of virtual discussion on arthritis in India, a national-wide dialogue. This series is a joint initiative by Voice of Healthcare and Pfizer, where we talk about the different areas of arthritis, its care, its management strategies in India. Today, we will be discussing and understanding what is arthritis, the different types of arthritis there are, the different management strategies. We'll talk about the prevalence, about the public health initiatives, and the measures one can implement for arthritic prevention. So, without further ado, I welcome my experts from Maharashtra. We have with us Dr. Mitesh, Valvi, Ortho Clinic, Yash, Krupa Society, Chiku, Wadi, Borivali, West, Mumbai. Good evening, Dr. Mitesh. Thank you for joining
Yeah, good
us.
evening. Yeah, hi. All good.
Thank Yes, sir. Thank you. We have with us Dr. Prashant Chotalia, consultant rheumatology at Rheumatology Clinic, Surat. Good evening, Dr. Prashant. Thank you for joining us. And we will also have Dr. Jeet Savla, consultant orthopedic surgeon at Apollo Spectra Hospitals, Mumbai, who will be joining us subsequently. So, without further ado, let's start the discussion. So, my first question will be for Dr. Mitesh.
Yeah.
Hi,
Yes.
Dr. Mitesh.
Yeah,
Yes.
hi. Tell
For
me.
everyone who has joined, all our audience, let's talk about understanding arthritis. So, what exactly
Okay.
is arthritis? And please describe the different types of arthritis that are out there.
Okay. Okay. So basically, my profile, as you see, that I'm an orthopedic surgeon, and people coming to my clinic mostly, I see a lot of patients with your knee pain and the back pain. So coming back to arthritis, the patients which we normally see are most commonly the patients who fall into the primary arthritic group, that is, osteoarthritic group. Now there are two types of arthritis. One
Mm-hmm.
would be primary osteoarthritis and secondary osteoarthritis. So I'll be talking more about primary arthritis because Dr. Chotalia would take care for the secondary one because it is related to rheumatology. Okay,
Mm-hmm.
so now if you talk about primary osteoarthritis, you would see that overall the scenario, let it be global or it be India, it is one of the leading cause of disability. Okay, so nowadays, if you see patients who are above, say, 50 or 60, they would come to us with your problems of, having, if they cannot walk a certain distance. After walking for a certain distance, they would feel that their knees have started paining. And
Mm-hmm.
there are a lot of issues related to the hip also. So normally, arthritis is going to affect your hip and the knee joint, and arthritis, osteoarthritis, is basically the degeneration of the joint or a
Mm-hmm.
mechanical wear and tear of the articular cartilage which covers your bone. There is a, like we have the laminates on the table, there is something called the articular cartilage, that is a protective covering around the bone. Okay, and it is in the both the sides. I mean, let it be the knee or the hip, there would be covering over both the bones, which is going to prevent the friction of the that joint, per se, that joint. So when there is an mechanical wear and tear of these
Mm-hmm.
surfaces, you might start getting this pain. So that's what. So basically, in short, arthritis is a mechanical wear and tear of your joints, and most
Right.
commonly affecting the knee, the hip, and then the smaller joints of the hand.
Right.
Yeah,
Thank you, Dr. Mitesh,
yeah,
for that
yeah,
good start, good introduction to our
yeah,
session. Moving over,
yes.
Dr. Prashant, my next question will be for you. Just like Dr. Mitesh said, we'd like for you to continue describing the types of arthritis. There are more primarily on the secondary type of arthritis. Also, talk about the common signs and symptoms that you see in your clinical practice that patients in their day-to-day face who are suffering from
Okay.
arthritis. Please.
Okay. So, as Dr. Valvi has suggested that the primary arthritis is basically the osteoarthritis, and what we see is basically the inflammatory arthritis. So, the
Mhm.
gross difference between what orthopedicians see is the non-inflammatory kind of arthritis, and what we see is basically the inflammatory kind of arthritis. Now, these are the
Mhm.
broad terms. In the layman's term, if I say, so there are three basic types of arthritis that we treat. One is the rheumatoid arthritis, second is the gout, and third is the ankylosing spondylitis. Now, these are some fancy names, and we don't actually have, unfortunately, Indian name for this disease. That is the issue, that patient don't remember what kind of arthritis they have. But
Mm-hmm.
grossly for rheumatoid arthritis, some people say it Gathia, some people say it Sandhivat, some people say it Va. These are the common terminology which they use. It mostly
Mm-hmm.
affects femur and small joints of hand. For gout, commonly people remember that arthritis as a arthritis because of uric acid. They
Mm-hmm.
they come to us with high uric acid report. So that is the common presentation for gout. And third one is the ankylosing spondylitis. It is a type of arthritis which generally affects younger male, and it is associated with stiffness in the back, which is more in the morning. Unfortunately, we don't have Indian name for this disease, so people tend to forget what kind of arthritis they have, as I said. Now, if we look at the common signs and symptoms, now broadly the difference between the degenerative or the wear and tear kind of arthritis and our inflammatory arthritis is that patient will have joint pain along with significant swelling around the joint. They will have
Mm-hmm.
more problem early in the morning after rest. They will feel stiff in their body, stiff in their joint, and that stiffness may persist sometimes for 3, 4, 5, 6 hours. And once they take the
Mm-hmm.
hot shower, they start working, that pain and the stiffness eases. Apart from that, because of the inflammation in the body, patient with inflammatory arthritis tend to have feeling of feverish. They have with malaise, that is fatigability, weakness, those kind of things. And the predominant presenting manifestation or the symptoms with which they present to doctor depend upon which type of joint is involved. Sometimes they come with only knee pain and effusion, means knee pain and swelling around knee. Sometimes they come with multiple joint who have pain and multiple joint with swelling.
Right. Thank you, Dr. Prashant, for pointing out the common symptoms. Moving over, Dr. Mitesh, my next question will be for you.
Yeah.
Talk a little bit about the diagnosis and the importance early diagnosis holds in any kind of
Yes.
arthritic case, please.
Yes. 100%. Now, see, if coming to primary arthritis, as I told you, osteoarthritis, it majorly affects your older population. If you see the
Mhm.
global scenario, it is more
I think
years.
we just lost
Yeah,
Dr. Mitesh's connection. Yeah, Dr. Mitesh,
yeah,
please
yeah,
continue.
yeah. Sorry. So basically, it affects males who are above 50 and females who are roughly around 45. That we call they fall into a post-menopausal group when a lot of changes, hormonal changes, take place in the bone, the bone quality basically.
Mhm.
And so if they are diagnosed early, so we are able to prevent the surgeries like your total knee replacements and many surgeries which are there. If they basically arthritis are graded into four categories: grade 1 to
Okay.
grade 4. Okay, grade 4 being the last stage where we need to do a total knee replacement. But if it is diagnosed early in say grade 1 or grade 2, only by your lifestyle modification you can prevent further degradation of the joint. Okay,
Mhm.
so like if it is picked up in early say 50s or maybe late 40s in women, so what you can do is you can simply get away with very minor changes in your lifestyle, like if you are now Indian population, basically many people till now have the habit of sitting down on the floor and having food. Okay, so what we always advise is like sitting on the chair, like meals on the dining table, the use of
Mhm.
commode, the use of elevator. These are certain things which we can promote and we can prevent the arthritis. Okay, once the bony changes have occurred, they are irreversible. Then by no means we are going to, get the regeneration of the articular cartilage. No doubt, India is progressing, and we have got very good alternative medicines now to which help in their regeneration of the cartilage. That is what they say. But still, we are in the pipeline. Okay, we are in the process. So early diagnosis along with your lifestyle modification and your regular exercises, you can surely prevent these arthritic conditions. So those are things what I would advise people. Why do we advise a
Mhm.
regular exercise, or let it be a simple walk for half an hour, 45 minutes is good enough to keep the joint stable, and regular exercises in the form of physiotherapy.
Thank you, Dr. Mitesh, for pointing that
Yeah,
out. Moving over, like you were saying about management. So, my
yeah,
next question will be for Dr. Prashant. Let's talk a little bit about how different clinicians manage different arthritis. So, I want you to elaborate a little bit about the effective strategies of arthritic management In your views, the medical, the surgical, the lifestyle modifications that you prefer, and then eventually my same question will be for Dr. Mitesh as well. So please start, Dr. Prashant. Yeah.
So for any disease, we generally have two kind of therapy. One is the non-pharmacological or a non-medical therapy, and other is the medical, which include pharmacological and surgical treatment.
Mm-hmm.
Now, for arthritis, the non-pharmacological advice depends upon type of arthritis. Suppose a patient is having gout, that is means he is having arthritis because of increased uric acid, then we have to look at the risk factor for that, like obesity, alcohol drinking, hypertension, diabetes. All these are the risk factor for development of gout. So we can address those factors and try to decrease the uric acid, so it will prevent the attacks of gout. Similarly, if some patients have rheumatoid arthritis, and rheumatoid arthritis has been also shown to be associated more with the obesity, more with the inactivity, more with the cigarette smoking. So we can advise patients to avoid this. So these in brief are the non-pharmacological management. But in India, the most important thing is that patients are not following the non-pharmacological advice at all in all the diseases. So we have to start initially with the medical management only. Now
Mm-hmm.
for arthritis, if I say specifically for arthritis, which are we see in the rheumatology, which are the rheumatoid arthritis, ankylosing spondylitis, or gout, we generally start with the medications which are known as DMARD, which are disease-modifying anti-rheumatic drugs, and there are various injections are also available. And with the early initiation of this medication, we can prevent the long-term complications of the arthritis, which is damage to the joint, and ankylosis. Ankylosis means the bone at the joint get fused with each other, so patient will not be able to move any joint. And for that stage, we have to go with the surgery. So broadly speaking, lifestyle modification, then the medications or the injections which are available, which are effective, and which are not as much harmful as it used to be in the 50 20 years ago. And then if
Mm-hmm.
patient develops complication of arthritis, then we have to move on to surgical management, which may include deformity correction or sometimes replacement of a joint.
Mm-hmm. Thank you, Dr. Prashant, for starting to talk about the different management strategies. Moving over, Dr. Mitesh, anything that you'd like
Yes.
to add? And also,
Uh,
my very specific question will be talking about the recent innovations and the advancements that we are
okay.
seeing in the treatment modalities available for arthritis in India. Please.
Yes, yes, yes. As rightly said. Now, first thing, what even every physician would do, or let it be a orthopedician would do, would be treating the arthritis conservatively. That is non-pharmacological. The treatment can be divided into three groups, like a non-pharmacological. Second would be a non-pharmacological.
So we're missing out on your voice. I think you got a call in the middle, so your microphone has just been disabled. If you can maybe rejoin quickly, we'll start with Dr. Prashant meanwhile, and you can jump back in. Dr. Prashant, back to you.
Okay.
So, in your opinions, any recent advancements that we are seeing in the space of
Yeah.
arthritic care in India?
So, so like we have landed on the moon, and there are many researches are going on for the management of arthritis, and people are living life like a normal person. The only thing is
Mhm.
they have to take the medications regularly. Now, initially we used to treat with the medications like painkillers, which we call NSAIDs. Then came the era of steroids, but then we came to know that there are many side effects with these medications. And then there are many medications which come in the line which have less side effects and they are more effective. And with that, we can control the disease early. We can prevent the damage, which include the drugs. If I say so, for some drugs name, methotrexate, leflunomide, sulfasalazine, which are the medications which we commonly use. After that come the era of biologics. Now, biologics are recombinant proteins which are available in the injectable form, and they drastically improve patients' condition who were refractory to the previous medication. And now we are moving further in the towards the precision medicine. Now, what precision medicine means? Every patient is different. Every patient's
Mhm.
genetic, every patient's proteomic or protein profile is different. And from research, we can identify which patient will benefit with what kind of particular medication. So, some arthritis patient will have elevation of cytokines, which are basically the proteins in their blood, and they are associated with causing the damage. And we can Now we have identified many cytokines and we are in the pipeline of developing many therapies directed against this particular molecule. So we are moving towards precision medication. So for inflammatory arthritis, basically we are moving towards more and more of biologicals and less of DMARDs, mainly in the refractory cases. For initial stage, we still use the old age tested drugs which are safe, which are effective.
Right. Thank you, Dr. Prashant. We also welcome Dr. Jeet Savla. Hi, good evening, Dr. Jeet. Thank you for
Hi,
joining.
good evening. Sorry for being a bit late.
No problem, sir. No problem. We were just discussing between Dr. Prashant and Dr. Mitesh about what arthritis is. So we have already covered the different types of arthritis, the common signs and symptoms, and we were talking about the management strategies that each clinician deploys. So my question to start with the conversation with you, Dr. Jeet, will be provide an overview on some effective strategies for managing arthritis, including both physical, for medical, for surgical, and the lifestyle approaches that you in your clinical practice use. Over to you.
So, first and foremost, you need to understand the patient profile as
Mm-hmm.
to if the patient doing regular exercise, what is the weight of the patient, if there is any
Mm-hmm.
deformity, the management principle changes based on the symptoms and the clinical examination of the patient. So, no, most of the patients belong to the geriatric age group, most of them.
Mm-hmm.
Like nowadays, the younger patients, the percentage of younger patients having arthritis is increasing nowadays. But even though, at least in my practice, I have more of these geriatric patients who come to me with arthritis of the knee and all. So what I need to see first and foremost is if they have any comorbidities. Now the basic line of treatments are you can either give them opioids or NSAIDs. These are the usual drugs that you start with.
Right.
So if the patient is eligible to take NSAIDs, if the patient are creat raised, if they have some heart issue or something, then normally I tend to avoid giving them NSAIDs. Then what I
Mm-hmm.
do give them is opioids. I depend more on opioids. And then also on the non-medical treatment, which includes giving them braces, asking them to make some lifestyle changes as to avoid sitting cross-legged, squatting, then
Mm-hmm.
exercising regularly. So these are the things that that I do rely on if the patient has comorbidities. But if the
Right.
patient has effusion along with arthritis, now quite a lot of people have effusion along with arthritis. Their joints are inflamed. So that is the time when NSAIDs do work better as compared to opioids because they help in decreasing the effusion also. If you
Mm-hmm.
can't give NSAIDs to the patient, then an intraarticular steroid injection can be given, which does the same thing. Once there is no effusion, and if the patient is affording, then you can always give them the option of using a hyaluronic acid. Now,
Mm-hmm.
these injections, although they are very expensive, but if the patient can afford it, then it is a very good line of treatment to prevent the progression. Like it won't prevent the progression, but it slows down the progression of arthritis,
Correct.
also decreases the pain, and the movement also becomes a bit better because of the oiling of the joint.
Right.
Last but not the least, if the patient is not happy with any of these, then there's always that surgical option that you can give to the patient.
Right. Right. Thank you. Thank you, Dr. Jeet. Welcome back, Dr. Mitesh.
Yeah. Hi.
So yes,
Sorry.
no problem, sir. No problem. Now that we have spoken of management strategies and we have understood what
Yeah.
arthritis is, I'd like to
Mhm.
move the conversation towards people who are living with arthritis. So let's try
Okay.
to have a conversation around it. Dr. Mitesh, my question for you will be any coping strategies that you recommend to individuals to effectively manage arthritis in their daily lives? Please, Dr.
Yeah.
Mitesh.
See, basically, as I told you, I just started with the treatment protocol, right? I told you that it can be treated non-pharmacologically, pharmacologically, and the last option would be the surgery part. Okay, so
Mm-hmm.
grading according to the grades, we can treat the patients. Non-pharmacologically, I told you that lifestyle modification plays a very important role. Like I told you, sitting down on the floor has to be avoided. So these are certain things what is very important for the patient to follow. Diet is equally important, as you know that if the patient is obese, then losing weight. So these are all lifestyle modification programs what we have normally. We can just start with it along with your medications. And there are certain many people have it in their mind that the older concepts that you use the stairs more, so your joint would be good and mobile always. That concept we normally do not recommend, as arthroplasty surgeon, like a joint replacement surgeon, would not tell you that you use the stairs in the place of your elevators. I always tell the patients that you can walk on a flat surface. There's no harm in walking on a flat surface for how much ever time you want to, but you need to always follow and do the exercises also on regular basis. So that is what is to be done. You have to avoid repetitive use of the joints. If you are overusing the joint or you are overexerting the joint, obviously the articular cartilage, that is the covering I told you on the surface of the bone, that is damaged, and ultimately it leads to degradation of the joint. So whatever possible we can do is we can retard the process by all these things, and if they are not controlled, then 100% we would go for a pharmacological treatment. And as Dr. Jeet rightly said, that there are a lot of newer injections which are available. Viscosupplementation is like hyaluronic acid, which he has told. Nowadays there are a lot of PRP, stem cells, and growth factor concentrates, which we are using in the grade 2 and grade 3 also sometimes. Okay, so these are things what can be done, but regular exercise, yes, diet is very important. They play an important role in this prevention.
Thank you, Dr. Mitesh,
Yeah.
for that elaborative answer. Moving over,
Yes.
Dr. Prashant, my next question is for you. Could you discuss about the support systems and the resources that are available to help individuals with arthritis to lead a fulfilling life? Please.
Uh, as we were discussing the coping strategies would include two things. First is the physical coping, and one is the mental coping, especially for our patients of rheumatological disease, because they are going to have the disease for life, and many a times they are not accepting that. Mainly when the disease starts early in the age, like 15 years, 20 years, 25 years, and when they transition from their childhood to adolescence and then adulthood, it becomes very difficult for them to get adhered to the treatment, and then eventually end up with the complication. So for the mental coping, we generally have support groups, and if you, there is a website of Indian Rheumatology Association, and on that you can find various support groups. Like I live in Gujarat, and we have two support groups from Gujarat itself. One is from the Ahmedabad, and that is for ankylosing spondylitis. Other is for the Sjogren's syndrome, that is also based in Ahmedabad. And similarly, we have a rheumatoid arthritis support group from Pune, and they have their own websites where they can have patient testimonials. So patient can talk to patients like them. So they will feel more ease. They can accept the
Right.
therapy. And they will have that pamphlets regarding the information of the medications, exercise. Even the support groups plan meeting once in a while, and they discuss various things like treatments, what are the possible side effects, what could be the outcome, what are the non-pharmacological management. So we have
Right.
this kind of support groups all over the India for different diseases. And for the physical coping mechanism, if we can treat early, then we will prevent the damage. But once the damage has occurred, we have to advise them certain lifestyle modification, as we already discussed. Then we can provide braces, we can provide different orthoses, like different kinds of boots, different kinds of sandals, cane, sticks, walker, etc. So that will help them in the routine day-to-day activities, and we can obviously take the help of occupational therapists and physiotherapists for improving their quality of life.
Right. Thank you, Dr. Prashant. Dr. Jeet, if you'd like to add to any information that you have for support systems and resources available for arthritic patients, please.
See, first and foremost, I would say that you need to properly counsel the patient as to their expectations. We need to understand their expectations, give them a realistic view as to what all is possible and what won't be possible. Now, if you talk to a arthritic patient, they'll always say कि अभी एक बार arthritis हो गया मतलब अभी जिंदगी भर रोना ही है, medicines लेते ही रहना. So that is not always the case. Like in the initial stage, if you do visit your doctor and if you do your proper now non-pharmacological management as to exercising, bracing, and all, then medicines to a very large extent can be avoided. Okay,
Okay.
the same won't be possible for rheumatoid or arthritis or other forms of inflammatory arthritis. But the most common form of arthritis today itself is osteoarthritis.
Right.
So at least that can be avoided with lifestyle modification. So what you need to do is make the patient understand the fact that एक बार हो गया है, तो this won't go. What we can do is make sure that we can decrease the pain, decrease the symptoms that the patient is facing, and make sure that major daily activities of the patients are not getting affected. Having said that, we can't, it is not always possible to give a absolute pain-free joint to a patient who's already suffering from arthritis. So that is a very important fact that the patient needs to understand. Then what you can do is you can share a few numbers of your other patients living in the same vicinity with this particular patient. You can make a group, share your small short films or short videos with this group,
Mhm.
and they can talk amongst themselves also as to what one is facing, how the other is coping, and they can help each other. It is more like a symbiotic relationship. One can help
Right.
the other to cope with their problems. Like it is
Right.
rightly being said, then there are those groups where the patient can join and meet people suffering from similar problems, which
Mhm.
will help them to cope with the situation.
Right. It serves as a testimonial. It serves as an increase in confidence, I think. Very, very rightly said, Dr. Jeet. Moving over, Dr. Mitesh, my next topic of discussion to start with you will be talking about the different variations in the prevalences that we
Okay.
see across India. So, I want you to put some light on the variation in the prevalence that we see according to socio-economic group, urban rural differentiation, age, and
Yeah.
talking about the different types of arthritis we see depending on these variations in the prevalences, please.
Yes, yes, yes. Now, if you see that overall, the population wise, if you see in India also, you would see that 80% of the population would be affected by your arthritis. Out of which you can say that 50% in the urban and 30% in the rural population, you might find osteoarthritis. If you see the rural population, they generally would not come up to you very early. Okay, but in urban population, obviously these people are, when your daily activities are getting affected, they are going to come to you, because we have, if you see, the urban life is way faster than the rural life. And here we cannot miss out on our time. We are tied up with our schedule. So what happens is, it is very easy for us to get access to the medical sector. So they would connect with us early, and they are, patient education plays a very important role. If you see the urban population, they are very well educated now. Let's see, take it for our today's program, along with voice of healthcare and Pfizer, they are doing a patient education program, for so that, overall there is a a great exchange of info, and all your information regarding arthritis, let it be the primary arthritis, which is age related, affecting the normal age, normal people, and there is something called secondary, which are the arthritic patients. Now arthritic would set in, there are two different set of doctors who are handling it. I per se
Mhm.
would not handle a rheumatoid patient. I would rather send him to a rheumatologist. We have easy access to the super specialty branch here, but in the rural areas they ignore the normal arthritic condition. So forget about the rheumatology thing. So patient awareness programs are very much required. So that is what is very important. And keeping that thing in mind, rural, you would find a lot of patients who would be sitting down on the floor, working in the fields. So they are overusing the joint sometimes, but their diet also plays a very important role. Here in urban population, we have a problem with the diet also. So if I see a lot of patients from the BPO or the call centers for that matter, they come with a totally different eat and sleep cycle. That also plays a very important role. They are,
Okay.
sometimes some people are very inactive, some people are obese. So these are all contributory or the risk factors which are coming along, and they are having a solid impact on the bone health. Bone health is something which has taken a toss because of the diet. So
Right.
those things have to be corrected. Yes, 100%.
Thank you, Dr. Mitesh. Dr. Prashant,
Yeah.
adding over to what Dr. Mitesh just spoke of, what do you feel are the certain specific challenges or barriers that exist in regions of India where we aren't able to provide quality arthritic care? What do you feel?
So if we look at the regarding the prevalence, as my colleagues have already said that the most prevalent arthritis in India or anywhere in the world would be osteoarthritis. And our rheumatologist did a observational study in which it shows that over a period of last 10-15 years, the prevalence of osteoarthritis are almost doubled. So we
Okay.
will have more burden as the population ages. We will have more burden of osteoarthritis. Let
Hmm.
alone along with that also we are now recognizing more and more new inflammatory diseases, and we are having increase in the prevalence of rheumatoid arthritis and other inflammatory arthritis also. And as Dr. Mitesh rightly said, that there are various factors which are unique to India as compared to the foreign nations, and that's why our patients are not being treated early. First is the ignorance by the patient themselves. Nobody will contact a doctor for back pain. They usually go to a pharmacy, they will take the medication, they will get relief, and they will avoid it for few years. Second thing, various social taboos are there. So they will go to some Ayurvedic medication. They will go to some Baba. They will go to some any other places to get rid of their arthritis. Sometimes they are being misguided by their family member itself. यहाँ पे नहीं, यहाँ पे जाओ, मुझे वहां से ठीक हो गया. So these are the various unique factors which we face, not the foreign countries. So we have to increase patient awareness, as Dr. Mitesh rightly, through this kind of programs, through various charities, through various community programs, etc. And those are the main barriers. And apart from that, most of the time, what happens is that they don't have access to a good healthcare, good hospital, or a good doctor. Means in periphery, you will find a general practitioner. They will try to give them symptomatic treatment, but then at a certain level, they cannot provide them with the adequate treatment because they don't have access to good labs also, where they can diagnose this disease and refer the patient. And once they advise to get referred because of the poor financial condition of the patient, even if they are being consulted by the rheumatologist, they will take the medication for few months and then they will stop, because most of the government hospitals, they don't have a regular stock of these medications for rheumatological diseases, and patient have to buy or purchase these medications from their pocket. While in US, most of the rheumatological medications are being covered under insurance scheme. So our patients, sometimes they take the medication for a few months and then stop the medication. They don't consult
Mhm.
the doctor and they revert back to their Ayurvedic medication.
Right, right. Thank you, Dr. Prashant, for talking about the gaps and the barriers that we see. Uh, Building on what you said, my next question will be for Dr. Jeet. So, how can healthcare providers and clinicians such as yourself work together with communities to improve arthritic care at the grassroots level? What do you feel?
So what I do feel that what we can do is keep such sessions more often in future, so that a proper patient education can be given to all the patients. Now, out here, this forum is specifically, I would say, for those patients who have access to at least mobiles or at least some form of video in which they can see this video. Now, a vast majority of patients don't have these facilities also. So, what
Right.
we can do is take sessions in colleges, schools, or for that matter, those MNCs. You can go to MNCs and take sessions over these topics. So,
Mhm.
how that will help is we can address this issue at a preventive level rather than at a secondary stage when the problem has already occurred. Well,
Right.
we've repeatedly said that this problem, if it occurs, it cannot be reversed. It can only increase in severity, but it cannot be reversed. So, might as well address the problem where it has not occurred as yet at a preventive level. So, places like schools, colleges, MNCs, where there are young people working nowadays, there's this big issue for ergonomic problem, ergonomics leading to various other problems which were earlier seen at a older age group. So
Correct.
you can take those sessions over there so that the people can be educated in a better way
Hmm.
and
Right.
prevent the entire thing. Like if at the age of 30, 35, if a person starts exercising, maintains a proper diet, is vigilant regarding the joints and his own body, if the patient is not ignorant as to the symptoms that the body is giving, then we can achieve that level where we can decrease the prevalence of arthritis at a very large level. But for
Right.
that, we'll have to work towards it and make the patient educated regarding these problems.
Right. Right. Very, very rightly said, Dr. Jeet. Thank you for that. Moving over, Dr. Mitesh. My
Yes.
next question will be for you, bridging on what Dr. Jeet and Dr. Prashant just spoke of. Any
Yeah.
successful initiatives or governmental or non-governmental organizations that you're aware of who are providing awareness on arthritis, and also some support groups for patients living with arthritis that you're aware of?
Okay. So basically, see, now as I told you, there are certain NGOs who are working for all these
Mhm.
things. So we are many a times we are taken to a very remote or a rural place just for the sake of a medical camp. Medical
Mhm.
camps are conducted by many NGOs in many of the tribal areas which are nearby Mumbai also. So basically, my area of practice would be Mumbai. So from closer to Mumbai, say not more than 100 kilometers, we are taken to certain remote areas where they do not have an access to the electricity also. So there are certain camps which are conducted. They are screened for certain conditions, and once they are screened, then basically all the faculties, not only the orthopedic, whoever is there with us, many a times there are like general surgeons or ophthalmologist or physician for that matter. They would come and they would collectively help and help to diagnose certain conditions and help that community. So there are a lot of NGOs who are working for all these things, and medical camps are conducted, educational programs are conducted, and in-person programs, not a
Mhm.
virtual one, but we have to travel to those places. We have to educate them that way. And there are NGOs who work and they provide the braces or
Mhm.
certain medications which they can take in their say emergency conditions for till
Correct.
to subside the pain and everything. So we
Right.
teach, not if not a doctor is not available, there are certain volunteers of certain NGOs. They are
Mhm.
readily there to help the society. So we train them or we educate them, and they would stay back and they would do those kind of therapies. You can say not exactly physiotherapies, but exercises and everything. What the volunteers readily do it for them for the society.
Right.
Yeah.
Thank you, Dr. Mitesh. Talk. You just spoke of what I would say a multidisciplinary approach for
100%.
arthritic
Yeah.
care.
Yeah.
So with the same conversation, Dr. Prashant, my next question is for you. In your experience, what is the collaborative effort or the partnership, and how has it proven effective in combating arthritis in India?
So in most of the rheumatological diseases, they are all the multi-system disease. We have to deal with all the specialties. Like sometimes arthritis, patient come to goes to ophthalmic surgeon with uveitis or scleritis in the eye, and in the investigation it is found that patient is having vasculitis or rheumatoid arthritis that is causing this red eye. Similarly, sometimes arthritis can present with dermatological manifestations to a dermatologist.
Mhm.
Sometimes they go to orthopedician for back pain and they send the patient to us that patient is having ankylosing spondylitis.
Right.
So collaborative effort is must for properly treating all the rheumatological conditions. And apart from the orthopedician, dermatologist, ophthalmologist, we also need a collaboration from the physiotherapist because when patient develop joint damage or when they undergo surgical management for joint replacement something, there is a important role of physiotherapist in improving the quality of life and getting the patient back to their routine life.
Right. Thank you, Dr. Prashant. Dr. Jeet, your opinions on the collaborative efforts that we see for combating arthritis in India. You're on mute, sir. Yeah.
Sorry, sir. As Dr. Prashant has rightly said, an arthritic patient cannot be managed by any one person. So you need an orthopedic, you need a rheumatologist if it is an inflammatory arthritic condition. Then you need a physiotherapist. At times you need an occupational therapist. Now a patient suffering from some inflammatory arthritis might have uveitis. So then you need an ophthalmologist with that. A dermat might be required for some skin
Mhm.
problem in this commonly seen in psoriatic arthritis. So
Right.
what you need is an entire team effort. Sometimes some form of arthritis causes neck stiffening and also you need a physiotherapist for that. So you need
Mhm.
an entire team of doctors and medical personnel to help an arthritic patient to lead as normal a life as possible. I would not say a normal life, but the best life that we can give to the patient based on that particular patient and his symptoms and the clinical and the stage of the condition that the patient is suffering from. The best that we can do can be should be given to the patient, but that requires a collective effort.
Right. Right. Thank you, Dr. Jeet. Moving over and talking about addressing arthritis in the vulnerable population. My next question will be for Dr. Mitesh. As we know, elderly and a certain group of people with limited access to healthcare resources are the vulnerable populations. How do you feel arthritis actually impacts these vulnerable population, very precisely talking about the elderly for arthritis? What were the changes in life that they see living with arthritis?
See, now one factor which is very commonly missed by many of them. If you see a lot of patients who are coming to us, say above 60 or 70, they are now retired. They want to live a life where there is not a lot of things to do. So what happens is when this arthritis sets in, and if it is lately diagnosed, what happens is they are not able to do their routine activities.
Mm-hmm.
Day by day the pain goes on increasing. The range of motion, what we say is, the joint movements are getting stiffer day by day. The pain goes to that level that they are confined to only their homes. They do not go out. What happens is then there is a state where these patients are psychologically affected. Okay, they
Right.
do not go out of the house, thinking that if I go out it will be very painful. Then there is no support system for them to go out, so they would not go out and socialize. And once they are confined to the house, there are certain patients which we have seen, I see it on regular basis, that they are generally depressed. And either if their sons or daughters are going to get them to us, maybe when they get time, and when we analyze the situation, I might give them everything for the pain to go away, but the psychological factor is missed. Sometimes there are times when I tell the patients and the relatives to take a psychological counseling sessions for that
Hmm.
also. Many a times they are in a fear that abhi, there is a lot of pain, so I'm not going to go out. Once I have managed the pain factor also, okay, but out of that fear, they do not go out, and then they are totally depressed, and on top of it they start taking medicines for your to get for insomnia, what we call. They are deficient of sleep. So all the
Right.
factors, your sleep cycle changes, your eat cycle changes, they are a bit
Mhm.
depressed, they are not very much involved in any of the family functions, and
Mhm.
ultimately everything in the family gets affected just because of this thing, because the pain has not been managed early. If the pain is managed
Right.
early, obviously the patient well-being, mental well-being is also very good, and that is a very very important factor which we many a times we miss. Once a patient is active, he goes out. Now I've got patients who are as old as 85, who for them we have done a total knee replacements, and they are going out and they are attending all the functions possible, everything. And just before getting under the knife, they were confined to one room. So that is one thing. See, surgery is the last resort, but there is something which has to be taken care of before it goes to a level where they are going to confine
Actually.
themselves to your house. So pain management plays a very important role. Physical therapy, like physiotherapy, is a very and an integral part of our
Mhm.
management system. Okay, so
Right.
emotional thing, second thing would be your physiotherapy. It plays a very important role, and your medicines and your modifications. So these are
Right.
certain things which we need to take care. In cases of other conditions like your inflammatory arthritis and all, obviously they would also put them on a lot of anti-inflammatory. They might also have some, they have specific groups like Dr. Prashant told that they have certain bodies which look after certain single or different entity at all. We do not have those kind of groups per se, but yes, we can just get all the patients together for some sessions in, like say, once in 2 months or once in 3 months. We take the patient's review, we put it on our social media accounts, so that people are exposed to all these patients who have benefited from the treatment, and they get a boost in the morale. That is very
Right.
important.
Thank you, Dr. Mitesh, for putting out that elaborative answer. I'll
Yeah.
start with the next question with Dr. Jeet, and this question I'll follow on with Dr. Prashant and Dr. Mitesh subsequently. Dr. Jeet, what are some common myths and misconceptions around arthritis in India that you'd like to bust through this arthritic awareness campaign? I just unmuted you, sir. You can. You're on mute.
I'm very
Yeah,
sorry. I'm very sorry.
please,
So
sir.
the
Please.
first thing that I would like to highlight in this topic is, first of all, arthritis is not a problem of the old age. Nowadays, many young people are having arthritis of the joints. I would
Mm-hmm.
say traumatic arthritis amongst young people or inflammatory arthritis amongst young people is getting common by the day. So it is not that arthritis only is a problem of the older age group.
Mm-hmm.
Having said that, arthritis is not also the end of the road as to कि अब arthritis हो गया तो life खत्म हो गई. That is not the case anymore. There are various medical and surgical treatment options that can be given to the patient so that they can lead a pain-free life. So arthritis is not the end of the road. It is just a problem that we need to solve and pass by it. Arthritis thus requires patience effort also in terms of lifestyle modification and exercise. If you're not ready to exercise, if you're not ready to make those changes in your lifestyle, then to expect that you will have a pain-free joint just on
Mm-hmm.
the basis of the medical management or the surgical management won't be possible. Even a TKR surgery requires exercise to be done so that the muscle strength is achieved and the patient can walk pain-free. So it is not that a patient can achieve a pain-free joint without doing any exercise or any lifestyle modification on the patient's part.
Mm-hmm.
So
Thank
these
you.
are
Thank
some
you.
of the common points that I have seen my patients asking. And what they do
Mm-hmm.
expect is say the first question will be, Doctor, हम जमीन पे बैठ पाएंगे कि नहीं?
Mm-hmm.
Indian toilet use कर पाएंगे कि नहीं? Now, if you
Mm-hmm.
ask them whether they won't have an Indian toilet in their house, but they just want to know that. उनको
Mm-hmm.
जस्ट वो एक लिबर्टी चाहिए कि द डॉक्टर शुड से कि आप कर पाओगे. नो यू
Right.
वोंट बी एबल टू डू दैट. एंड दोज आर
Mm-hmm.
थिंग्स व्हिच कैन बी इजीली अवॉइडेड. ऐसा नहीं है कि इंडियन टॉयलेट में बैठने से ही यू
The life goes on. Right.
या. So these are some of the things that the patients also need to understand.
Thank you, Dr. Jeet. Dr. Prashant, anything that you'd like to add to the common myths and misconceptions that you've seen in your
The chunk
practice?
of patients that we see is slightly different from what our orthopedicians see. We generally have a younger vulnerable group, mainly the lady who are in their 20s or a boy who is having 13, 14 years old. And we have different kind of issue with that. And the most common myth that I would like to bust is that many a times it is considered that the arthritis is genetic, especially the ankylosing spondylitis. And once they get the report of HLA-B27, somebody told them कि ये तो आपको पूरी फैमिली में होगा जीन में, तो they started getting panicky कि मेरे बच्चे को भी होगा, मेरी बच्ची को भी होगा. So not
Mm-hmm.
all the arthritis are genetic. So being genetic, and there are arthritis which are genetic, but they don't have 100% penetrance. Means you have the defective gene, but you will not manifest the disease. So there are various environmental factors also that interact with the genetic factor to cause the disease. Of course, when you have arthritis in a family, the chances of having arthritis, some or other kind of arthritis in family member increases as compared to normal population, but it is not 100%. Second, people say that कि diet से ही सब कुछ ठीक हो जाएगा. So no, it doesn't work like that. Diet will certainly help you, because when you avoid junk food, when you avoid the fried or excess calorie food like मिठाई या वो सब, so they will
Mm-hmm.
generally improve your overall health, and that will help you counter the inflammation which we see in the body. So you
Right.
cannot control arthritis with the diet alone. These are the two things that I would like to highlight. Rest I think covered by Dr. Jeet.
Thank you, Dr. Prashant. Dr. Mitesh, anything that you'd like to quickly add to this
No,
ongoing topic?
yeah. Hey, everything covered by both the experts. Nothing left for me to say. Yeah,
All right, all right. I think
yes.
moving on with the next question, Dr. Mitesh, I'll ask you as we are moving towards the closure of this panel. Let's talk
Okay.
about some preventive measures that individuals can take to reduce their risk of developing arthritis or reduce
Yeah.
their risk of progressing the already developed arthritis. In your opinion, please.
So that's what we've covered almost everything in the past sessions. So one thing is, I would stress on would be exercises, regular exercises, regular walking. Not only only simple, as I told you, walking would also have a very important role. There are certain exercises like I always recommend my patients that you can surely go for a swim. Swimming is a very good form of exercise, not only for your all your muscles of the body or something like that, but for your heart, for your lung. That is one kind of exercises which is good enough, fair enough, and the younger individuals can 100% keep a very very good health by just going for swims. And diet, as I told you, eat and sleep cycle should be good, your diet should be good enough. And these are certain things which they can do in cases of in cases of injuries, or maybe in cases of surgeries which are previously done. So when we know that we have undergone a this thing, what is a surgery for your per se, or left or the right knee, or any of the joint per se, so we need to take good care of that. Surgery is not the last thing which is going to keep the joint good. After surgery also, there are a lot of exercises which you need to do. Now there are certain nowadays one field is evolving. It would be the aquatic therapy, or what we call physiotherapy underwater, and against the resistance. That those things are also having a good impact on the total health of the joint. So these are certain things which I would recommend.
Thank you, Dr. Mitesh. Dr. Jeet, my next question will be for you. Any technological advancements or digital tools that you have seen that have proven to be beneficial in the arthritic management and treatment in India that we see?
Uh, Recent advances, I would say, the MRI, the use of MRI being done in early arthritis. There was a point where we used to only rely on X-rays for arthritic management, but nowadays getting an MRI done in early arthritis, so that the chondral loss can be uh, pinpointed at an early stage where the symptoms are not that prominent as yet. So nowadays, I've seen young people getting MRI done, directly coming to the clinic with an MRI done, in which there will be written those terms like chondral fissuring, or decrease in the chondral layer, or erosion of chondral surface. So that is a very good thing in a way, because these are those patients where arthritis can be prevented at a very early stage. Like it has just started, and the patient will come to you with those MRIs and all, and the further progression of the disease can be prevented.
Right.
Also, if the patient is affording this, I've seen more in those city at a city level. The patient has access to mediclaims and all. So if a patient has a knee problem, you can always get an arthroscopy done, visualize the joint by an arthroscopic surgery. And if there is any chondral loss or something, then chondrocyte implantation. And these surgeries, the use of these surgeries is increasing on a daily basis, so as to prevent further management, further progression of the arthritis. And
Right. Thank you.
recently, like, PO is not
Please.
something which is recent.
Please continue, Dr. Jeet. Sorry.
Okay.
Please.
So there's the surgery called HTO surgery, which
Mm-hmm.
is done to prevent the progression of arthritis. Earlier, this surgery, as from what I've heard from my senior, is the surgery used now. They used to not perform those surgeries that often as it is done today. That is because of the cost factor and now. But since the vigilance of the people has increased, the use of mediclaims have increased. Like I have patients, fruit sellers having mediclaims with them. So then you can easily make them, counsel them, and make them agree to a HTO surgery, which will prevent that progression of arthritis later, which can prevent a knee replacement surgery, like which can delay the knee replacement surgery to a very large extent.
Right. Right. Thank you, Dr. Jeet, for putting your light on that topic. So, as we move towards the end of this panel of discussion, my question to the open house is going to be: let's start with Dr. Prashant. Uh, are you there? Yes,
Yes.
Dr. Prashant. So, a key take-home message that you would like to give to all the viewers, be it your peers, be it patients who are suffering from arthritis, or the caregivers, a key message that you would like to give to everyone on
So the
this
first
arthritic
message
awareness.
is that ki first message is that don't get afraid of if you are being diagnosed with certain kind of rheumatological diseases. Now, first thing is to prevent. So maintain a healthy weight, avoid junk food, avoid fresh fruits, vegetables, dry fruits. Do any exercise, whatever you like. Just stair climbing can decreases the risk of heart attack. If you climb stairs daily, that also decreases the risk of heart attack. Walk, run, swim, whatever you want to do, just do some exercise. Maintain healthy weight and eat good. That is the first exercise for prevention. Second, for our rheumatological station, I would specifically say if you are drinking alcohol and if you are having gout, stop using alcohol. Second, if you are having rheumatoid arthritis and ankylosing spondylitis, don't smoke if you are smoking. So these are some preventive tips that will help you to prevent if you are asymptomatic and if you have disease, that these things will improve control of your disease activity. These are the things that I would like to advise. And second, if you are being diagnosed, don't worry. There are many people like you who are suffering from the same disease and they are living good life. Just get a good consult from a rheumatologist if you are having a rheumatological disease. Start medication, continue medication. If you have any problem with the medication, don't stop it. Just go to your rheumatologist, discuss with them what is the problem. They will provide you with the alternative solution, and just be happy and continue treatment and live your life.
Thank you, Dr. Prashant, for that wonderful message. Dr. Jeet, my same question for you. Talking about the key message that you'd like to give to all the viewers on this arthritis awareness campaign, please. Dr. Jeet, you're on mute once again. I'm really sorry. Uh,
Sorry, my bad, my bad.
no
So
problem. Please start.
the message that
Yes.
I would like to give to the viewers is to respect their body, take care of their body by exercising, by lifestyle modification, by following proper diet. Once you
Mhm.
take care of the body will take care of you in return by being fit and being pain free. But if you won't take care of the body, तो वो body भी interest में तुम्हें pain देगा. So it's
Right.
you should always respect and take care of your body. That is the only thing that I would like to stress in there.
Thank you. Thank you, Dr. Jeet. Dr. Mitesh, your take home message for everyone who is watching.
See, yeah, two things which we are learning from your school time. You can say that, the first thing would be prevention is better than cure. Okay, so one thing is always goes ahead would be, you always prevent these things. On for all the preventive measures have been, described by all of us. One thing is that, and second thing would be health is wealth. That is one very important thing, that if you work now, you keep moving, you are going to keep your joints and your body moving till you are really very fit, and so you don't have to face any of the issues with that.
Right. Thank you, Dr. Mitesh. So, with this, I'd like to bring this session to an end. I'd like to thank Pfizer for powering this particular arthritic awareness campaign. I'd like to thank Dr. Mitesh, Dr. Jeet, and Dr. Prashant for picking time out of your valuable schedule and helping us discuss about the different arthritis types and the prevention strategies that are there. Voice of Healthcare, thanks each one of you. Thank you for stepping up and have a good night. Thank you.
Thank you.
Yes,
Thank you.
thank you for giving us the
Thank you.
opportunity.
Good night. Thank you.
Good
Good
night.
night.
Thank
All
you.
right, take care.
Good night.